Traditionally, cancer treatments have included chemotherapy, sometimes surgical therapy, and radiation therapy. These have been tremendous treatments for many patients with cancer, but they can affect other parts of the body. They can destroy normal tissue. What we're doing now at Penn Medicine is using much more targeted therapy, trying to train the patient's own immune system to target their cancer specifically without all the collateral damage.
To make a new cancer therapy, what we did was program T cells to become like antibody-based B cells. Those cells then became, after this reprogramming, leukemia-specific killers.
The patients that we're treating have largely run out of other options. In fact, on average, our patients have been through 4 different types of chemotherapy for their disease, and it's no longer effective. Sometimes bone marrow transplants can cure patients who don't respond well to conventional chemotherapy. In fact, many of our patients were not even eligible or appropriate for transplant because of their age, because of the extent of their disease, and there really were no other effective treatment options.
Most people can't get a bone marrow transplant, and if they do, a lot of times they have lifelong problems with complications. So I began working on a therapy, doing basic immunology to learn how to grow the T cells. Those T cells come from a donor, someone else, and in our case, we're trying to do it where the patient themselves is a donor.
I first met Doug in 1996, shortly after he was diagnosed with chronic lymphocytic leukemia, or CLL. Many patients with CLL we can just observe for long periods of time, and initially he didn't need any treatment. But over the course of about 8 years, Doug had gone through 4 different types of treatment for his CLL, never achieving a complete remission. Doug enrolled in our clinical trial using our genetically modified T cells. In fact, he was only the 3rd person in the world to get treated with these genetically modified T cells.
I really saw it as a way to fight back, frankly. That I wasn't going to be continuing to be a victim of this thing. I really believed it could work.
For patients who participate in this trial, the first step is to collect their immune cells so that they can be genetically modified and therefore recognize their cancer and kill their cancer. We take the T cells out through an IV, typically in their arm. They're brought to our cell production facility, where they undergo genetic modification, and in fact they're expanded and grown in the laboratory over a period of about 12 days. They're then ready for infusion. Patients come into the office as an outpatient. The actual infusion is given intravenously, and it takes literally 5 to 15 minutes. When these cells are effective, they begin growing in the body. They start proliferating. And this has been associated with something we refer to as a cytokine release syndrome. It's like having a very severe flu-like syndrome. Patients typically will get fevers, maybe underlying nausea, anorexia, inability to eat. At this point, most of our patients actually get admitted to the hospital for management and very close observation of the symptoms. Doug was one of those patients, and he recovered extremely well. And roughly 3-4 weeks after we gave him the T cells, we ran tests looking for his CLL, and the results were amazing.
I was in David's office, Dr. Porter's office, and you know, we were sitting there, and he's looking at me. He said, "Doug, we can't find a cancer cell anywhere in your body." He said, "Your bone marrow is completely clean."
The immune system eradicated his tumor. He had pounds, literally pounds of tumor, and it went away in less than a week. It was an astonishing event that we saw.
You know, it was at that point I knew that I was going to be okay.
Doug is doing extremely well. It's been more than 3 years since he got his T cells. He remains in remission. His blood counts are normal. There's no signs of CLL. In fact, we can still find evidence that the genetically modified T cells that we gave him are surviving and alive in his body, and there are some signs that they're still active and, like a vaccine, have the ability to protect against relapse of his leukemia. So far, we've treated 32 patients with CLL on 2 different clinical trials. Roughly half of these patients have had very major, meaningful clinical responses. Half of those have had complete remission with complete disappearance of their CLL from their bone marrow, from their blood, and disappearance or resolution of all their enlarged lymph nodes and enlarged spleen or liver. With our experience treating adults with CLL at the Hospital of the University of Pennsylvania, it made sense to start treating other leukemias that express the CD19 molecule. My colleagues at Children's Hospital, led by Steve Grupp, began treating children with acute lymphoblastic leukemia, or ALL. ALL is a particularly aggressive kind of leukemia. It grows extremely rapidly. The majority of children can be cured of ALL, but when conventional chemotherapy doesn't work, most of these kids will still die of their disease. Dr. Grubb began treating them with the same chimeric antigen receptor modified T cells that we use to treat CLL, and the results have been remarkable. Roughly 80% of these kids have had a complete remission. These are patients that are completely resistant to other types of chemotherapy and would have died of their leukemia. The majority of these remissions have now been sustained over time. In fact, the first patient that they treated with ALL is alive and well now 18 months after her T-cell infusion. We've now started treating adults with ALL. We've now treated our first 6 patients, and we have good follow-up results on the first 5. All 5 have achieved a complete remission by every level of testing, including minimal residual disease testing. No patient has any evidence of ALL.
What we've shown in our cancer cases is that you can reprogram the immune system and make it more potent than it was made by nature. I think we now have the first indications that it's a very potent therapy and can work in very advanced, incurable cases of leukemia.